Hello, this is Dr. Stanley Lang. Welcome to this presentation. And today I'd like to talk to you about microinflammation and how it affects chronic pain, but also how it affects basically anything that is neurological. I had 3 different patients today that I needed to talk about microinflammation and where it starts, which is in the GI tract. And the concept here is that microinflammation gets its toehold, so to speak, in the body most of the time because our GI tract or our gut isn't in good balance. The balance of bacteria, which is called the tribe of bacteria that's in our gut, is called the biome, and we do lots of things that cause it to be out of balance. And so I see a lot of patients who have pain, various different sorts of pain disorders, or they have other kind of neurological issues. I saw somebody with chronic pain today, somebody who was a young child with autistic spectrum disorder, who had some gut microinflammation issues, and an older person who had had some recent confusion who also had some gut microinflammation issues. So one of the things that is the biggest causes of inflammation of the gut, which we can do something about, is an herbicide called glyphosate. Unfortunately, it's in much of the food that we eat. And as I was telling one of the patients today, that if it's a processed food, pretty much don't buy it. Eat foods that don't have labels. Cook from scratch so that you know that you're eating foods that have a organic basis to them. But anything else, the chances are pretty good that it's going to have significant amounts of glyphosate in it because of different ingredients that have glyphosate sprayed on it while they're growing. So glyphosate is something that is sprayed on all GMO foods. It's sprayed on much of the wheat. It's sprayed on a lot of other produce, and it's very difficult to minimize its exposure unless you cut out GMO foods and cut out non-organic foods. So that is a big change for lots of people. The main GMO foods that we need to cut out are corn and soy, and that will go a long ways to minimizing your glyphosate exposure. There's a lot of other GMO foods that have glyphosate sprayed on them also. But back to my patient, I could tell that she was having a lot more pain than she would have if she would be able to clean up her diet. And the reason I know this is because I've seen many patients do this. Once they decrease the inflammation, the inflammation sources in their body, once they improve the anti-inflammatory nutrients that are called antioxidants in their body, their pain level decreases, sometimes quite a bit. And if you have any kind of a chronic pain issue, and or you have some of these other neurological issues that are signs that your brain isn't working quite at its best, cutting out the things that are pro-inflammatory and damage the gut bacteria is the very first starting point that I encourage you to work on. And you can do this very easily by limiting the foods that I mentioned. In addition, using food-based probiotics, foods that naturally have probiotic bacteria in them, is much, much more effective than using probiotic capsules. And so I routinely recommend my patients to consume these foods, the main ones being organic vinegar and kefir, which is fermented milk. So you can make a big difference in how much inflammation is going on in your body by limiting the damage to your GI tract bacteria, and by then working hard to replace the bacteria that have been killed off by the foods that we eat that inadvertently we're poisoning our bacteria, our good bacteria, because of the chemicals that are in the food. So this is something that you've got control over. I encourage you to take action and to limit the exposure to the foods that are likely to have these chemicals. I wish you well, God bless, and have a great day.